Hi, everybody. Welcome to Virtual Psychedelics, How VR Affects the Brain. I'll be your moderator. My name is Liew from VR Playhouse. I'd like to first off thank South by Southwest for hosting this panel and for having us here today. I'd like to introduce our panelists. To my left is Dr. Sook Liew. She is an assistant professor at the University of Southern California and the director of neuroplasticity and the Neurorehabilitation Lab. Her work focuses on using large-scale brain imaging to understand how the brain recovers after an injury such as stroke, and using neuromodulation, like brain stimulation and computer interfaces with virtual reality, to help people get better after stroke. To her left is Khayyam Wakil. Khayyam Wakil is an award-winning creative and futurist with over a decade of dedicated science and the digital arts, with deep-seated roots as an entrepreneur. He is widely known and well-respected as a speaker, influencer, and innovator. He has been in the VR space since 2008 and served as Chief Innovation Officer at Immersive Media, the creators of Google Street View. Currently, he is the Chief Strategy Officer and Head of Creative Partnerships at Live Planet. And to his left is Taryn Southern. Taryn is a content creator and digital media advisor whose internet videos have received more than 750 million views online. She's passionate about VR for social impact and well-being, and has made 360 content for organizations such as Wish of a Lifetime and Mott's Children's Hospital to highlight the use of therapeutic VR. She is also an advocate of MAPS and MAPS psychotropic research, and is currently producing a documentary on the future of unlocking human intelligence, which follows cutting-edge research on neuroplasticity. Today, you can live tweet to me. I'll be looking here and trying to incorporate the feedback that you guys are giving us. And you can live tweet at VR Psych. So.
Hashtag VR Psych.
Yeah, hashtag VR Psych.
So if you have a question, just use that.
So, virtual reality is kind of the latest in a long tradition, ancient tradition of using altered states of perception to understand and hack into human consciousness and the way our brains operate. Using primary sensory experience as its means of delivery, we are able to finally sort of curate this experience in a way that is really unprecedented. So our panel today is to help understand the similarities between this and some of the psychedelic research that's been happening recently, as well as understanding how this fits into our current cosmology and how it fits into where human evolution is headed. So hey guys.
Hi.
So how does VR affect the brain? Yeah.
So I can talk a little bit about neuroplasticity in general. For the most part, virtual reality, especially head-mounted VR, is relatively recent. So a lot of the work on virtual reality focused more on using like large screens and things like that. And it really fell into a few different categories, and I think this still holds today. One category would be just to distract the mind, kind of like for relieving pain or keeping people out, like a medical use. Another is to motivate people, so within the field of gaming, using VR to encourage people. And I think that the most interesting line of research now is using VR to actually trick the mind, or trick the brain. So in this case, you can use head-mounted or immersive VR to put people in situations that they otherwise would never be in. We can study their behavior, we can study their reactions, and we can also study their brain activity. So I think this is kind of one of the newer areas that's coming up. Yeah.
I guess my experiences are, I used to be very adamant on social media. I've used a lot of the technology. And for a little moment, perhaps a year and a half, I decided to quit all of that. Removed my phone. It was very simple in the way I existed. And it was because of the ability of being able to manipulate trust. And I kind of, I say that these things are the biggest opium pandemic that we've ever had, and we give it to our kids. It's okay to do that. And as I approached into VR, I jumped and said, you know, we're putting a headset to our face, and we're putting earphones on our ears, and we're closing ourselves off to a reality. And that's, you know, I equated it to a heroin trip. You know, you go to this place where you completely cut off. And now that I heard that there's, you know, the psychedelics is probably a better drug to replace that with. But it truly is an experience where you can trick your mind. I mean, I've had experiences where I'm standing 2 inches off the ground on a 2x4, yet I put on a headgear, and I'm standing over a cliff. And I'm sitting there, I know that I'm only 2 inches. I can tell my brain, listen guy, you're only 2 inches off the ground, don't be afraid. Yet I drop to the ground and hope that something's holding me. So it's amazing how easily we can be manipulated through visual and especially on the audio side. So, back in the day it was mostly visual and the audio wasn't able because we only had an accelerometer. But now that we have the ability with the headset, we don't have any of the external reference points and we can put on sound. And both of those marry very well to tricking you into being in any situation whatsoever.
So I'm curious here, out of all the people in this room, how many of you have used a VR headset?
Oh.
Great, okay, so most of you. Of those that raise their hand, how many of you have used a tethered headset, like the Vive or the Oculus? Okay, so a good majority. Which is quite a different experience than some of the Google Cardboard. So I first got into VR because I was just, 2 years ago, I put on the HTC Vive and I was blown away. And I felt like I was transported through an experience not too dissimilar from that of a psychotropic one. And at that point, I felt completely committed to figuring out what this new intersection of science, technology, and psychology was all about. And while I'm not a scientist, I've always been a science enthusiast, and so I've been really excited about using this documentary that I've been working on as a way to learn more about how entertainment can impact the brain. And I think that this is really important for content creators who are actually making this content to be aware of, even if they don't have science backgrounds. So the areas that are most exciting to me are in the areas of motor control. We've seen patients, paraplegic patients, regain some level of muscle control after using virtual reality to encourage them to move a virtual body in space. Neurorehabilitation through BCI is another interesting topic that I'm studying in the doc. And then some of the more obvious areas like provoking empathy and help challenging implicit racial bias. These are areas that have gone quite a bit of studies in VR, and there's a lot of really promising things that are coming out of them. Another one is control over dreams. Oddly enough, people who are accustomed to playing VR games tend to report more awareness over their dreams and or more frequent lucid dreams. So for those of you who are excited about exploring lucid dreaming, VR is an interesting entry point or pathway into that.
I'd like you to talk a little bit about the piece that you have here in the virtual cinema and your work with Rehabilitation.
Okay, sure. So on the note of motor control and neuroplasticity, so some of the ways that we're using virtual reality in research is exactly what Taryn just said. So we have a brain-computer interface, and the idea is that it's a low-cost, portable machine that you can carry around in the suitcase, like the one I brought up on stage. And it's for people who have severe stroke. So after a stroke, your brain sends a motor signal to your arm to move, and then you would move your arm, and that would be it if you're healthy. But after a stroke, your brain sends the signal to move, and your arm doesn't move. And if your arm doesn't move, then you don't really reinforce that good brain signal. And so it's hard for people with severe stroke who can't move to recover. So one of the things that we've tried to do is what's called a closed loop brain-computer interface, in which we kind of close that feedback loop by reading the brain signals, and when they indicate an intent to move, we give them feedback in virtual reality of their own limb in VR moving. So we kind of replace the body that doesn't move with a body that does move in VR. And so that's kind of been an exciting area, and that's one of the ways that we talk about kind of tricking the brain. And I think that's where VR has been really exciting, also in this area of embodiment, right? So a lot of research has come out in the past maybe 10 or 15 years, where people show that you can embody basically any body that you're given in VR. So if you're given a body with really long arms, like extra long arms in VR, you will act as though you have extra long arms, and that effect persists even after you take off the VR headset for a little bit. So it's called adaptation. Also, if you're given a childlike body in VR, you'll start to show more childlike behaviors, which is really interesting. And so for health and rehab, we think that if we give somebody a whole body, a healthy body in VR, that maybe they'll also embody that body and kind of trick the brain into activating the normal neural pathways that they would without normally. Yeah.
That's cool. And then, Taryn, I wanted to ask you about your work with MAPS and kind of what MAPS is doing and what they're about.
So I studied psychotropics in college, which is not a typical major. But
Most of us just did that extracurricular.
yeah, so fortunately I went to University of Miami in Florida, and the Department of Anthropology down there, a lot of the professors had come down in the early years of the Miami drug trade to study what was happening amongst drug users and the politics and economics of that. So a lot of the classes that I had were in various studies of drugs, much to my parents' dismay. But went down to Peru for my senior thesis and worked with shamans and studying ayahuasca. And that was in 2004, so it was a little bit before it became the trendy thing to do. But I've just always had this intense fascination with how we can push the outer limits of the brain and what we can learn through these studies. And what's really exciting now, I've been following MAPS for the last 11, 12 years, supporting them, donating and going to some of their meetups and events. And we're now seeing this resurgence in psychedelic interest, not just among recreational users or people from spiritual communities, but in the academic world. So we've got, we just had I say we, I'm not one of the doctors, but there was just a stage 3 clinical trial approved for MDMA for PTSD in veterans. It's shown to be very, very promising and effective at reducing PTSD, as well as advanced trials on psilocybin and LSD at numerous universities that are top-notch universities. So we're seeing this resurgence of interest, and I think more importantly, a shift in the cultural ideas around these drugs. We're now looking at these drugs as drugs to keep people from using other bad drugs, as there is a lot of promising research about what they can do for people with addiction, trauma, depression, anxiety, etc.
That's really great. One thing I wanted to talk about was this idea of the feedback loop and how the psychedelic experience and the VR experience sort of participate in this feedback loop. Because there's a phenomenon in the psychedelic experience where whatever thought you're having or whatever kind of feeling you're in or environment you're in starts to amplify.
Yep, that's right. I mean, if you look at brain maps of people using VR and using psychedelics, they're certainly not the same. But you can see how quickly various other portions of the brain are illuminated when using either a psychotropic substance or something like VR. You're really activating different neural connections through different parts of the brain that may not normally communicate with each other, and or diminishing certain parts of the brain that make up our current reality. So one interesting side effect of using VR, which could be considered a negative side effect, and there needs to be more studies on this, but is disassociation. There's a disassociation from one's body, which is also something that happens when you're on psychedelics and can often frequently help people recall painful or stressful traumatic memories in a state where they're not, where they're essentially separating themselves, separating the ego from the former trauma, and therefore able to integrate that trauma more easily. And so I think what we'll see with some of the VR studies is quite similar, just in the brain reacting differently to stimuli and or personal experience through this new neural pathway being activated.
And for those of you unfamiliar with MAPS, they are the Multidisciplinary Association for Psychedelic Studies. They have a manual that I think is really interesting. It's called the Manual of Psychedelic Support. And it's actually, in that manual, there are a bunch of really interesting guidelines for VR creators. Things about, going back to Timothy Leary, ideas of set and setting, and how those factors can influence the start of a psychedelic trip, also influence how somebody perceives VR. I'd like to throw this one to Khayyam. How, in terms of set and setting, in your experience as a VR creator, how have you seen those two factors being used, both for people at live activations at places like South by Southwest, Also, you know, within the VR sort of environment inside the simulation.
Yeah, sure. I mean, I started when we didn't have headsets and we only had them on a little phone. So,
Sorry, I'm just going to move
yeah.
that.
So I started when we just were able to just do this. We had a 360 video and people would do this. And it was an amazing thing to watch because no matter what age the person was, they had this silly little 8-year-old grin on their face. And that's when I knew that this was something. Like, sure, there's technology, it's fancy, but when I saw someone smile, that tapped into this innocence, this childhood kind of imagination, which we sometimes forget. And so seeing that, you know, we move on to now using the headsets. Now we're trying to reproduce some of these kind of environments. And you know, most of them were lollipops and unicorns and all of that kind of thing to make everyone feel happy. While I was with Immersive Media, that company did a lot of work with many government bodies that have acronyms. And those acronyms have been using this technology to do exactly what we're doing, manipulating through, you know, giving those scenarios. So in certain situations, we're using it to solve some, you know, people in comas being able to react to that, people being able to move limbs that they never thought they could move. And now we have these other kind of entities using that same manipulation to create those environments. We are able to create these environments so real-like that we can believe them. So, you know, moving from, you know, I remember South by Southwest, I think it was 2013, we did an activation with Doritos. We put a 62-foot vending machine in the middle, or right across the street from the convention center. And they had a bunch of artists playing, but they had the actual Doritos bags sitting in the visualization above. You could pick whatever, you know, effect that you wanted, smoke, fire, whatever it was, so you were engaged in it. So we took this concert and brought them in through an app, and people at the venue themselves were looking at the 360. It wasn't the most amazing venue where you can see the stage. There were corners, there were VIP sections, and the fact that in 2013 you could see 50 phones up in the air doing this because they couldn't see LL Cool J, but they could see it right there, right in front of them. It created a social dialogue outside of the concert, in the concert. So that was another phenomenal point where all of a sudden I saw this community engagement over a phone, and everyone would flock to it. I would jump on airplanes, and you know, I would show someone, and people would lose their minds. You'd have 10 people standing up on an airplane. The flight attendants would come like, please, can you calm down? Everyone's getting a little too reactive. So what I see is from a very early time, it was tapping into that childhood innocence, and I really do enjoy this because what it is emotional intelligence. We're not taught that in school. We learn this, and as we're, you know, growing and getting all of this information, our emotional intelligence is growing, and a byproduct of that is empathy. You're not just gonna, you know, you can't put a serial killer into a VR headset and be like, oh wow, I just developed empathy for them. They would require emotional intelligence to have that empathy. So what we're doing is we're building that emotional intelligence and helping have that byproduct of empathy. We can actually tap into those things. We can actually feel. And so there are things that we can create in our mind that we can actually feel and produce. So we're starting to see that. Yeah.
So we actually, before head-mounted VR was a thing, we partnered with an artist who created something called the mirror box. And the idea of the mirror box was that you hold this thing over your head, two people standing face to face, and in between you is a mirror, and that mirror has a lighting system, so sometimes you're looking at your face, sometimes you're looking at the other person's face, and sometimes you're looking at blends of your face and their face. At the time, it was really revolutionary. Now you can do it in VR with like a few lines of code. But what we wanted to do was we wanted to see if people would become more empathic towards someone that they had never met before, if they started to see their face in their own face, a stranger's face in their own face. And I think that's kind of the idea behind a lot of this VR empathy work. The interesting thing that we found, so the way that we tested it is we did a test called the implicit association test. And so it's like a test where you kind of look at word pairings between yourself and positive words, or yourself and negative words, or some random other person and positive words or negative words. And you usually have an advantage for yourself. So you tend to, we all here, and everyone tends to think of themselves more positively than other people. And that means that you react faster when you see your name or yourself paired with something positive. And then we did that before and after they did the mirror box with a stranger. And what we find what we had hoped to find was that when you see somebody, once you're in the mirror box with someone and you kind of see their face as your face, you would have more positive feelings towards them. But we actually found the opposite. After you do this with somebody else, you just have more negative feelings towards yourself. And this kind of speaks to the idea that the concept of the self is actually a really fragile concept. It can be changed in a lot of different ways and with different manipulations. And so when people talk about VR as an empathy machine, I think it is really interesting and there's a lot of potential there. But what we think is that you probably have to talk the person through that experience. And like what you were saying is give them, kind of guide them through the emotional intelligence part of it. So you can't, it might not be as productive to just put somebody in VR and be like, now you're in a war-torn country. And because you might actually elicit negative effects or some sort of self-protective mechanism. But if you were to talk them through it and guide them through the emotional part, then it could be a more positive experience.
Yeah, and I'll just quickly add, because I thought the set and setting comment was a really good one and something that's worth noting. With both VR and psychedelics, I would never just put someone who's in a state of extreme anxiety, depression, or PTSD in a headset and put them through exposure therapy, which has been shown to work, but it's in a very controlled clinical setting. And I visited USC's Dr. Rizzo's lab and saw what he's working on. And I mean, I thought, I almost came out of there with more PTSD going through these war-torn environments in virtual reality because I am not the patient, right, that's going through the clinical setting. Same with psychedelics. So we know we can improve people with phobias in VR. That's a huge one, but could we just do that by giving it to them at home and expecting them to conquer their fear of heights or spiders all by themselves without clinicians? I don't know. I think that could be very dangerous.
I think no.
Probably not.
I think that'd be unwise.
Taryn, can you talk a little bit more about Skip Rizzo's work using VR to treat PTS and what the experience was like, the experience that you went through?
Yeah, so Dr. Liew, I mean, you might be able to speak probably more specifically about this. I went in and got to see sort of a range of what he's working on with veterans. They're also doing stuff with AI, facial recognition technology, where therapists who are built completely in AI can respond in kind to veterans who have psychological issues, and it tends to work better than with a real therapist because they can actually negate implicit bias using the AI as the therapist rather than a real human, which is interesting. That's one part of his research, and then another big component is this exposure therapy in VR, where they recreate various war settings that are applicable to the veterans who are receiving treatment. So actually rebuilding the exact environment of being in Afghanistan, of the tanks, of the sounds. They even employ haptic technology, so suits and subwoofer bass underneath the feet so that you can actually feel like what an explosion is like. And then as I believe if I'm correct, as the patients discuss the traumatic experiences, both in and out of the VR headset, they're able to sort of relive some of these experiences in a constructive way that diminishes their PTSD over time.
Yeah, exactly. So Skip's work is really innovative and amazing because it uses VR in that embodiment sense, where you can put someone in that environment that they otherwise would never be able to be in. And I think part of it too is that the environment it's no longer just in their head. It becomes a shared environment that other people can see and they can talk through it with somebody. And so there is some work on like reconsolidation of memories. So like if you have a memory, you can essentially trigger that memory, and then the memory can become what's called unstable. And at that point, you can try to change the memory. So you can do different manipulations, you can distract, and you can change, not completely like mind control change the memory, but you can make it more or less strong, essentially. And so I think part of it too is that by being able to trigger the memory visually and then talk through it, it allows people to address something that otherwise, and until now, has been in their mind, essentially.
Yeah, it goes from their subconscious to their consciousness, reconsolidated in a more positive fashion. And it's honestly very similar to the MDMA research that's happening right now with PTSD veterans. They're recalling memories under the influence of a drug, which disassociates them from the memory. They're able to recall it when their serotonin levels are a little higher than normal, and apparently it works. So it's very interesting, the parallels between those two.
So there's a researcher named Donald Hoffman who's published work about sense perception and how, up to something like 60% of what we perceive is built from our sort of core mythology or from our subconscious.